My name's Alex Reid. I'm a midwife, lactation consultant and child health nurse who works at the Mater Mothers Hospital. I'm just talking a bit about breastfeeding and the importance of breastfeeding and some of common things that you can do to improve your success or likelihood of success if you're planning to breastfeed. So it really is a great pleasure to have been asked to speak here today about a topic that's a great passion of mine and obviously of great importance to mothers all over the country. As parents, we all want to make the very best choices in everything that we do for our children, and there are many choices that mothers are facing before they have their babies, particularly things such as how we give birth, where we give birth, and with whom we give birth, as well as a lot of other well-meaning advice that we need to filter. However, when it comes to ensuring babies get the very best food, breastfeeding is the best choice. It's the start in life that nature intended for our babies. It's a complete food with all the nutrients that the baby needs for normal growth and development, and it absolutely cannot be replicated. It's a natural, healthy option for feeding our infants. However, as many of us will know, the early days can be difficult for both mother and baby, and not all mothers are successful in breastfeeding. Health professionals, therefore, need to give women the right kind of support and information so that they can give it their very best shot. If it doesn't work out for them, that's of course okay, and it's important then that this choice be respected. There's a huge body of research now that shows breastfeeding provides significant health benefits for both infants and mothers and society in general. In fact, the National Health and Medical Research Council has noted a number of health benefits for babies, which include things like a decrease in ear infections, in gastrointestinal infections, a reduction in prevalence of high cholesterol and heart disease in later life, asthma, diabetes, both type 1 and 2, and childhood obesity, as well as improving vision and IQ in babies. The thymus gland, which is responsible for our immune protection and prevention of disease, is more than double the size in a breastfed infant than a non-breastfed infant. If human milk, nature's perfect food, came stamped with an ingredients label, it would read something like 4% fat, vitamins A, C, E and K, sugars, essential minerals, proteins, enzymes and antibodies. It contains 100% of the recommended daily allowance for everything baby needs to grow, plus extras to help ward off a lifetime of diseases, from diabetes to cancer. Despite exhaustion, visiting relatives and dirty laundry, every time we nurse our babies, the love hormone, oxytocin, courses out of us like a warm bath. So for more than 4,200 species of mammals, breastfeeding is a natural process that ensures the survival of our species. Humans are the only mammals among that 4,200 that consider feeding their infants milk that's derived from another species. So is breastfeeding now a natural process or is it a learned activity? Well, in actual fact, it's probably both now. So the natural processes of breastfeeding are being lost because we no longer live in societies where we see our mothers, our sisters, our aunts breastfeeding. Many women have no contact with breastfeeding infants until they come to hospital and they're feeding their own baby. So it is in that way very much a learned activity. There are several things that you can do to improve the likelihood of success. And these things I just wanted to mention in brief today. The first one is skin-to-skin contact with your baby. Now what that means is that when your baby is born, they're delivered up onto the maternal chest, which is uncovered, so ideally you've got no bra on, no top on, and the baby rests against your skin naked. The skin-to-skin contact has been shown to have a very, very positive influence on breastfeeding. And when skin-to-skin seamlessly follows birth or is initiated in the period soon after, the studies have shown the following positive outcomes. Your baby will cry less, Mothers and babies interact more in that early period. Babies will breastfeed more, better, and for longer periods. The mother releases that love hormone, the oxytocin, which helps her bond with her baby. Mothers will lose less blood and develop that early milk, the colostrum. And mothers will feel more relaxed, affectionate, and less anxious. It also initiates a special immune response in the baby. So the baby becomes protected against all sorts of bacteria and pathogens around it. Skin to skin is recommended to occur in that first hour after birth and until after the first breastfeed that the baby has. So it's really important for those of you coming into birthing a baby that you delay the phone calls to all the relatives, delay the popping the baby onto the scale. The weight will still be there in an hour, but do your skin to skin and feed your baby, and that will set you up for a much more successful breastfeeding experience. Usually, when babies are having that skin-to-skin contact in that early postnatal period, it can alleviate and prevent common breastfeeding problems. Babies normally self-latch to the breast if they're having skin-to-skin, so they'll seek out the nipple independently, hop on and latch correctly, which prevents attachment problems. It can help to wake a sleepy baby for a feed. So if your baby's been a bit sleepy for a long period of time, you can pop the baby skin to skin and they'll normally wake up and feed. It helps to calm a crying baby, which is really important because crying babies can't attach to breasts. Their tongue hits the roof of the mouth and the nipple won't go inside. So you want a calm, happy baby that goes onto the breast. And that increase in or release in oxytocin helps you to produce more milk more quickly. So your milk will come in earlier and with a better supply. If your baby does require care in an intensive or special care nursery, we still encourage and promote skin-to-skin contact, which in the special care arena is known as kangaroo mother care, coming from the kangaroo's use of the pouch for their baby. The next thing that will improve breastfeeding outcomes is something simple called rooming in with your baby. Rooming in, or having your baby in the same room as you, has been the single most effective strategy that hospitals have employed in improving breastfeeding outcomes. It also helps to decrease the incidence of neonatal infections that were once commonplace when we had night nurseries or nurseries for babies when they were separated from mums. Being in the same room as your baby means that you're able to quickly learn your baby's normal feeding patterns and sleep cycles. It doesn't mean that you're going to be left alone to fend for yourself. All postnatal wards have midwives that will be available to you to assist you and help learn how to respond to your baby's cues. At the Mater, we have instituted a fairly unique thing called the baby care assistants, whose entire role is to just go around from room to assist mothers with their babies and help them to learn how to cope with the baby in the room with them. Babies do breastfeed better when they're offered a feed exhibiting early feeding cues. What that means is that your baby, when it wakes for a feed, will be quiet and alert, looking around. It might make some sucking sounds on its own tongue. It might suck on its fingers. Those are all the early feeding cues where we want to respond and offer the feed. Crying is actually a late feeding cue, and the baby becomes very disorganised and finds it more difficult to latch and feed successfully. So you'll be able to respond to those or to your baby's cues when your baby is obviously close by. As I mentioned before, it also reduces the exposure of the baby to all sorts of pathogens and bacteria that surround us in our environment, but particularly in hospitals. There's also a safety strategy that nobody really likes to think about, but we still have babies fed by incorrect mothers when they've been roomed, or incorrect babies fed by incorrect mothers when they're rooming out of the room with the mother. And some of you will be aware in Victoria that recently we've had babies mixed up. So having bubs in the room with you will prevent that from occurring. Recent studies have shown mothers actually get more sleep when they room in with their babies. So it's a fallacy that if you have the baby out in the nursery, you'll get extra sleep. It has been shown that you have a hormonal release when you're breastfeeding your baby that makes you sleepy and relaxed and helps you to fall back to sleep quickly. So although you will be tired in the first few days after the birth, you will have help and you'll quickly learn to sleep when your baby sleeps. That's probably a very useful tip, is just trying to get to sleep whenever your baby's sleeping. Minimise your visitors. So some of the normal things to know about breastfeeding in those early days is that breastfeeding is a use it or lose it function. It is also a commitment that we make to our babies. A newborn baby will feed around 8 to 12 times in a 24-hour period. Some of the feeds will be long ones and some of them will be short ones. If you think about how we eat, we don't eat the same sized meal every time we eat throughout the day. Some of us have one large meal and several small ones and a few snacks. The same with sleeping patterns. We don't all sleep 8 hours a night. Some of us need more, some of us need less. So it's unreasonable to expect that a newborn baby is going to have the same sleep intervals and the same amount of feed each time they feed. Allowing your baby to determine how often and how long they feed is known as demand feeding, and this is what we now encourage. Again, it's easier to do this if the baby's close by to you. It helps you to bring your milk in faster and establish a better milk supply. And also your baby will gain weight more quickly, which is important in those early days. It is normal for babies to wake and feed at night time until around 6 months of age. So just to give you a guideline there. Babies that do not wake at night usually don't gain adequate amounts of weight, and you'll find that your milk supply will start to reduce. We have a hormone that produces milk called prolactin, and that surges at night time. So we need to utilise that and have at least one feed in that nighttime period. As I said, you do have these special hormones that pass into your milk and your bloodstream that make both you and your baby drowsy when you breastfeed. So that helps you to fall asleep quickly after a breastfeed, but it also makes your baby more likely to settle quickly as well. Now, how do we know that a baby is getting enough at the breast? I think this is probably the most asked question I get in the hospital. It's really quite simple. What goes in comes out the other end. So breastfed babies should have around 6 wet nappies, heavy wet nappies, in a 24-hour period after the first 4 to 5 days. And they should also have around 2 or more soft yellow liquid poos. This is a sign that all's well and that your baby's getting everything they need for normal growth and development. Babies also have regular growth spurts, and this is another thing that many women find very confusing. The baby will breastfeed more frequently for around 24 to 48 hours each time the baby goes through a growth spurt period. And that's the way that the baby sends a message to your breast that it needs to create more milk and meet the demand of the baby. So they will do this regularly during their breastfeeding lifespan. Okay, sorry. Your milk will change constantly as your baby grows and develops, and it will even change in response to your baby being unwell. And I think that's something very, very unique about breast milk. The milk that you create when your baby is a newborn or at 6 months is completely different to the milk that you create when it's 12 months old. If your baby becomes unwell with some sort of virus, your milk will increase the amount of antibodies, proteins and sugars to help support the baby and whilst they're unwell and make them healthy again. A few things just to look at avoiding that are inhibiting to breastfeeding. Obviously, in the early days, it's important that your baby, whilst learning to breastfeed, we keep things as easy as possible and try not to confuse the issue for them. So hopefully your baby is only being offered the breast. That's the only thing they know. We want to try and avoid the use of dummies or pacifiers for the first 3 to 4 weeks until breastfeeding is established, and then use them if you wish to do so. You can use a clean finger in the baby's mouth. That's fine if you're really needing to settle. We also want to avoid the use of bottles and teats as much as possible. Babies suck on a teat in a completely different way to the way they suck at a breast. They use a piston action on a teat, and they use a wave-like motion at the breast. So because there's two very different sucking patterns, moving between the breast and the bottle can be very confusing for a newborn baby. You want to try and avoid giving any other fluids other than your breast milk to the baby, things such as water or artificial baby milks. The reasons for this is that offering formula will compromise your baby's immune protection because it changes the normal bacteria that lives in the baby's gut. This can increase the risk of your baby's exposure to allergies and some other diseases. Formula also takes longer for a baby to digest than breast milk, so it means then that the baby will have less feeding opportunities if they've had formula. It also increases the likelihood of you getting engorgement in your breast, which is uncomfortable, and it can delay the establishment of breastfeeding, so you may find that you have an ongoing low supply. It can also reduce your confidence in your ability to breastfeed. The fact that you're providing only breast milk to your baby, it's a learned activity, as we said. It's a bit like riding a bike. The more you practice, the more you realise you're on the right track. You learn your baby's responses, you see that you meet them, and you feel good about that. Lastly, I guess, I've talked a lot about the mother's role here in breastfeeding. However, breastfeeding is very, very much a joint exercise. Support is key. Support has really been shown to be one of the single most effective strategies that mothers receive in increasing longevity of breastfeeding. So fathers and partners are important, very, very, very important to the success of breastfeeding. It has been shown that their attitude, knowledge and support influence both the initiation and the duration of breastfeeding. So I wish you all the very best of luck and success in your own breastfeeding journeys, and invite any questions if you have any. I'm happy to answer anything. Thank you.